So if you're here, I'm guessing there's a pretty good chance your leg feels like it's plugged into an electrical socket, and you are just tired of being confused. That sharp zinging pain is bad enough, but the anxiety of not knowing what to do, that's a whole other level. Well, in the next few minutes, we're going to cut right through all that noise. I'm going to give you a clear, step-by-step guide so you can understand what's happening, know when it's an emergency, and learn what you can do right now to start getting some control back.
You know, this quote really hits home, doesn't it? 1 minute you feel okay, and the next your leg just lights up. It feels so dramatic, you almost can't believe it. But that inconsistency, that's a classic sign of nerve pain. It doesn't mean you're imagining things or being weak. It just means a nerve is really sensitive, and a certain movement or position just flipped the on switch. Getting that is the first real step.
All right, so let's dig in and get crystal clear on what this pain is, and maybe more importantly, what it isn't. Because honestly, knowing exactly what you're up against, that's half the battle right there.
You've probably heard this word thrown around a ton. Maybe a friend had it, maybe a doctor mentioned it. But what does sciatica actually mean? Is it a diagnosis, an injury? Let's clear that up right now.
Okay, this is absolutely key. Sciatica isn't the problem, it's the symptom. Think of it like a smoke alarm that's going off. The alarm isn't the fire, right? It's just the thing telling you, hey, look over here. There's a fire in the kitchen. Sciatica is that alarm, and it's telling you to look at an irritated nerve root in your low back. Now, if you remember one thing from this whole explainer, please let it be this. Does your pain feel like a sharp, distinct line shooting down your leg? That's nerve pain talking. Or is it more like a diffuse, achy cloud that's kind of spread out in one spot, like your butt or hamstring? That's probably muscle pain. This line versus cloud idea is your single best tool for figuring out what's going on. Okay, so now that you have a better handle on what kind of pain you're dealing with, we have to tackle the most important question first. Look, most sciatica is absolutely miserable, but it's not dangerous. But there are a few rare situations you absolutely cannot afford to ignore.
And let's be really clear about this. This isn't about toughing it out or waiting to see if it gets better. Knowing when to get urgent medical help is all about protecting your long-term nerve function. So we have to take this seriously.
All right, take a deep breath and look at this list. I mean, really look at it. If you answer yes to any of these questions, it's time to stop what you're doing and seek an urgent medical evaluation right away. These are what we call red flags, and they mean you need a professional to take a look, and fast. And this brings up such a critical point. Pain screams for your attention, right? It's loud. But weakness is often the more important signal. It's so easy to focus on the burning or the zapping. But if you suddenly notice your foot is starting to drag, or you can't lift your toes up like you could yesterday, that's a real change. That's a signal you can't ignore.
Okay, deep breath. We've gotten through the scary, urgent stuff. Now, let's pivot to an action plan that puts you back in the driver's seat. When a flare-up hits, your first instinct might be to either freeze in place and not move at all, or to try and aggressively stretch it out. Here's the thing. Both of those can totally backfire. Here's a smarter way.
So what's the goal here? It's actually really simple. We just want to reduce the sense of threat to that nerve. Micro walks give it gentle, safe movement. Swapping positions means you're not compressing it for too long. Heat or ice can help calm down the pain signals, and a smart sleep setup just gives it a break overnight. This isn't about being a hero, it's about being strategic.
Think of this as your personal decision card. If your pain is that sharp electric line we talked about, then your number one job is to calm things down. That means micro walks and position changes are your best friends. But if it's more of that dull, cloudy ache or just tightness, you might be ready for some more targeted, gentle mobility work. You gotta listen to what your body is telling you.
Okay, let's talk about the real-world stuff. Making smart decisions when you go to get help. Because, let's be honest, navigating healthcare can be tricky and super expensive. But a little bit of knowledge here can save you a whole lot of time, money, and frustration.
The big one. When you're in that much pain, it feels so natural to want an MRI, right? You just want to see what's wrong inside. But is rushing to get one right away always the smartest move? The answer? Well, it might surprise you.
So here's the kicker, and it's a big one. So many people walking around right now with absolutely zero pain have disc bulges that would show up on an MRI. It's just a normal part of life for a lot of us. Getting a scan too early, before you've even tried to calm things down, can create a ton of anxiety and might even lead you down a path of treatments you don't actually need. The best time for an MRI is when the result is going to help you and your doctor make a specific decision, like should we try an injection?
So when you do go get help, say from a physical therapist, it pays to know how the game is played. That first evaluation, that is often the highest value appointment you can have because it gives you a clear diagnosis and a roadmap. And notice, getting some basic home equipment is often a much smarter and way cheaper first move than jumping straight to expensive imaging.
And that's really the bottom line. A great physical therapist is your coach. They should give you clarity about what's going on, a home plan that you can actually stick with, and clear goals for your recovery. If you feel like you're just going week after week for passive treatments with no real plan, it's okay to ask for one.
All right, so we've put out the immediate fire and we've figured out how to navigate the system. Now, for the most important piece of the puzzle, building a long-term strategy so you can stay in control and slash the risk of this happening all over again. Seriously, if there is one single habit you take away from all this for preventing future flares, let it be this. Set a timer on your phone for 25 minutes. When it dings, just stand up, walk around for 60 seconds, then sit back down. That's it. This one boringly simple habit breaks the cycle of constant pressure that annoys that nerve. It's free, it's easy, and it is incredibly effective.
And here it is. This slide right here pulls the entire game plan together into one simple map. Step 1, you calm the crisis. Step 2, you systematically restore your function, paying close attention to how your body responds. And Step 3, you know exactly when and how to escalate to the next level of care if you're not making progress. This is your roadmap. This is how you take back control.
We're going to end on this really powerful idea. It is so easy to fall into the trap of thinking you just have to endure this pain, to be tough and power through it. But real control, real dignity doesn't come from endurance. It comes from having a smart strategy. It's about making calm, intelligent moves, understanding what your body is telling you, and always having a plan. And now you have one.